Okay, so we are still continuing on talking about chapter 18. Diverticulitis is a disease that was first recognized around 1900 when the amount of processed foods that we started to eat on a daily basis started to increase. The consistency of stools has become more solid, which then requires more intestinal contraction, which then increases the pressure in the colon. What this can cause is some weak spots that kind of form these little pouches, um, and fecal matter, parts of food, etc., end up getting caught in these little pouches. And then you get bacteria, which then causes inflammation and then can lead to infection. The main symptom is pretty severe abdominal pain, generally in the lower abdomen. Signs include fever, malaise, so just generally not feeling well, body aches, chills, nausea, vomiting, and the pain can be actually pretty severe. If they let the infection go too long, what can happen is the colon itself can actually perforate, so it can have a hole created in it. And oftentimes to fix that, they end up having to go in surgically and remove the infected, inflamed, perforated portion of the bowel. And then you have a colostomy for a little while till all of that heals, and then they reattach your colon without that piece that they removed. So this can be a huge issue. Hemorrhoids. So hemorrhoids are created by swelling and inflammation of the blood vessels that surround the rectum. May result from conditions that end up increasing pressure on the rectum or irritation of the rectum itself. Some of that increased pressure may be because of pregnancy. Pregnant women oftentimes have a lot of hemorrhoids. Straining when you're trying to poop, and chronic constipation. So the more that you have hard stools, the more likely it is that you're going to have hemorrhoids. On the other side of the spectrum, if you have diarrhea constantly, that can cause irritation, which then could lead to hemorrhoids, but it's usually because of the other direction. Presents as bright red blood during defecation. Typically when somebody wipes, they notice blood on the toilet paper. The bleeding may look like quite a bit, but it's actually pretty minor. Pretty easy to control, but it just kind of freaks people out when they see blood on their toilet paper. Patients may also experience itching, pain when they try and sit down, or they can actually feel like a mass on their rectum. So could feel like a tumor, just like a growth that kind of freaks people out too. As far as problems with the urinary system, cystitis, which is a bladder infection, is super common, especially in women. So women have a much shorter urethra than males do, so that tube that leads from the bladder to the outside world. Men's, because it goes through the penis, is actually relatively long. A woman's doesn't have all that tissue to go through, so it tends to be much shorter, much easier for bacteria to gain access through that urethra up into the bladder. And then that can spread even further up. So it's typically caused by a bacterial infection. Patients usually complain of lower quadrant, abdominal, or pelvic pain. They may report an urgency or frequency in urination. So that when they have to pee now, or they feel like they're going to pee their pants. Another thing they commonly say is, I just feel like I have to pee all the time, but then when I go to the bathroom, like nothing or very little actually comes out. They may also report a burning sensation when they urinate. This can become a pretty serious problem if it continues to infect up. So this actually can spread to the ureters or to the kidneys. If it spreads up to the kidneys, it causes pyelonephritis, which is inflammation of that kidney. The kidneys themselves play a major role in maintaining homeostasis because they eliminate waste from the blood. They balance fluids. They balance electrolytes. They help control blood pressure. And there's just quite a bit that goes on here. If the kidney starts to fail, uremia results. So that's a buildup in uric acid. And the waste product, the urea, actually remains in the blood instead. You can have kidney stones based on all of the intake that you have that it's filtering out that can actually grow and cause blockages. You can have crystallized chemicals within the urine. You can crystallize uremia. The blockage, if you have a kidney stone, can lead to swelling. You tend to get pain with kidney stones, but only when the stone is moving within the ureter or the urethra. If it stays still, it's not as painful, but people with kidney stones tend to relay a pretty severe pain that comes and goes, and it comes when that kidney stone is moving within one of the tubes of the urinary system. A kidney stone may pass on its own. It may have to be surgically removed. It may have to be broken down with ultrasound. It kind of depends on where it's at, how big it is, what it's made out of, and how that's affecting the patient and their overall condition. At times, your kidneys can fail to work properly, and there's two types of kidney failure. There's acute kidney failure and chronic kidney failure. So acute kidney failure is when there's a sudden decrease in kidney function. This often occurs from hemorrhage, dehydration, shock, sepsis, heart failure, medications, drug abuse. Kidney stones can do that as well. And acute kidney failure is reversible if you diagnose it quickly and treat it quickly. Chronic kidney failure, on the other side, is irreversible. It develops over quite a bit of time, so often over months, maybe years. People with diabetes and high blood pressure are significantly more prone to have chronic kidney failure. The kidney tissue itself often starts to shrink, which causes a decrease in overall kidney function, and eventually the patient is going to require dialysis or a kidney transplant to effectively remove waste from the blood. Symptoms include altered level of consciousness, seizure, coma, lethargy, nausea, headaches, cramp, and then edema within the extremities or in the face. Female reproductive organs. So gynecologic problems are a pretty common cause of acute abdominal pain, since a majority of the female reproductive organs are housed within the pelvis or lower abdomen. Lower quadrant pain can relate to ovaries, fallopian tubes, or the uterus itself. There is a whole nother chapter on this, so we're not going to go into it right now. We'll get to it when we go through chapter 23. So some other organ systems that can lead to acute abdominal pain. So the aorta itself lies immediately beyond the peritoneum. So it starts from the heart with that aortic arch, and then it curves, and then it keeps going all the way down through the body until it splits into the iliac arteries and then down into the femoral arteries. If you get a weakened area within that aorta, you can end up with what's called the AAA. So an aortic aneurysm, abdominal aortic aneurysm. AAAs are pretty difficult to detect. You need to be very careful when you're trying to assess or detect a AAA, because you may end up rupturing it. Oftentimes when we're trying to check for a AAA, we end up palpating, and if we get a little too forceful, we can cause some pretty big problems for our patient. The development of the aneurysm itself is very slow, but it can collect quite a bit of blood, and if it tears or ruptures, massive, massive hemorrhage, especially from the aorta itself. The pain itself is described as more of a tearing sensation, and what we want to do is just very calmly and gently handle the patient in order to transport them in, because they are going to require surgery for sure. Pneumonia can end up causing that ileus and abdominal pain as well, because especially if it's in the lower lungs, your lower lungs sit right on top of your diaphragm, which is pretty darn close into your abdomen. A hernia, so this is when you have a weakened hole within the muscle and you have an organ or a tissue that protrudes through a hole into somewhere that it does not belong. Hernias can occur because of a congenital defect, such as around the umbilicus, so they might have an umbilical hernia, a surgical wound that has failed to heal properly, or just natural weakness in an area, such as the groin. Hernias may or may not produce a noticeable lump. Hernias that can be put back into place are said to be reducible, and reducible hernias tend to not cause very many problems. Incarcerated hernias, however, are the ones that can't be pushed back in, and they end up getting compressed by surrounding body tissue. Strangulation is when an incarcerated hernia starts losing blood flow and is a serious medical emergency. If the blood supply is compromised by the compressed surrounding tissue, you could end up losing parts of whatever tissue is protruding. Serous hernias and symptoms, formerly reducible mass that you can no longer reduce. Let me go to the next slide. Pain at that hernia site, tenderness when the hernia is palpated, and then a red or blue skin discoloration over the hernia, indicating that there's some sort of bleeding issue going on. For scene size up, we go the same steps back to back every single time. So scene size up is going to be first to make sure that the scene is safe and that you have on your PPE. You may want to consider donning a glove or putting on little booties just in case. Number of patients, do you need additional resources? Nature, mechanism of injury or nature of illness if you need it. The acute abdomen can always be the result of violence, such as blunt or penetrating trauma. So make sure that you keep yourself vigilant, just in case. Sorry. Use your assessment results to develop an early index of suspicion for any sort of life threats. A patient that's super pale, looks super shocky, may have internal bleeding, may have a AAA. So we want to be very careful with our patients. And GI bleeds tend to have a very characteristic odor. Oftentimes, if somebody has a pretty pronounced GI bleed, you can smell it. It's really hard to describe what it smells like, but you will not forget the smell when you do smell it. We will go further into assessment in the next video.